Bismillah ar-Rahman ar-Rahim. Assalamu alaikum, everyone. It's a pleasure to be here at this conference, especially after Professor Iqbal Afridi. MashaAllah, sir, what a great work you have done for the country. And I congratulate you, your team, and all the colleagues of making a difference for our population. Probably some of you or most of you know me. I graduated in 91 in Pakistan and spent a couple of years in South Africa, then went to US around 1996 and spent about 20 years in US. In 2014, Qatar leadership asked me if I can come and build a system for the country. So countries are small. It's a small country. I do some clinical work, but a lot of my now efforts goes into how to build systems at a national level, how to make policies at a national level, and how we can make a difference at a national level. So I will tell you a brief journey. I will not keep you very long. I know you all are hungry for lunch, so I will be as quick as possible. So I don't have any financial disclosures to make. So what I will do is define the historical perspective for child and adolescent psychiatry and perinatal psychiatry services in Qatar. Before I came in 2015, what was it like? Identify the current services which we developed in last 6 years and where we're going in the future. So how many of you been to Qatar? Not many. Okay. So Qatar is a very small country, actually probably smaller than the city of Lahore. So it's a very small country, about 11,000 square meter, with neighboring countries, mainly Saudi Arabia and Bahrain and UAE are pretty close. This was in 1935. One of the pilot of Royal UK Air Force took this picture in 1935. Population was just 4,000 or 5,000, not many people. So it was how it looked like in 1935. As you know, Qatar has an Amir, and very lot of times it's in news, mainly for World Cup football is coming up later this year, and also Qatar plays a big part with Afghanistan and Hamas and Lebanon and Beirut and Palestine, so they are involved with a lot of those kind of activities. So this is a Miri Dewan in 1973, which is a parliament house in Qatar. This is, let's see. So if you see, there is only one building. This is where current skyline, the downtown area और main जो शहर नहीं होता जहाँ पे वो है, तो ये सिर्फ एक होटल होता था शेरेटन 1980 में. So this was how it looked like in 1980. So this is a picture just 3-4 years ago. So this is the skyline. I've seen a Manhattan skyline. I think Doha, mashallah, have a beautiful, much beautiful skyline than New York. And you can see that hotel at the end, which was there in the beginning. For the World Cup, a lot of new cities have made. Lusail is one of the cities, 8 stadiums, world-class stadiums. Lusail Stadium is, I think, the last one. This is a new hotel, and this is a brand new Lusail city, metro. So a lot of projects have done. So the reason I was saying is that's where psychiatry was. When we started, you saw where Qatar was, where we are, and where we're going. So I will show you a few things where we were, where we are, and where we're going. So country has a vision. So it is human development, how you develop the country, and then the health system and education sector development. So this is population of Qatar. In 1951, 26,000. Now it's about 3 million population. So only about 700,000 children below 15 years of age, and we have about live births of about 30,000. Why that is important? Because we're talking about perinatal psychiatry, because we need to cater these women. So before 2015, there was only one child psychiatrist, Dr. Hanan, before I came, and one child psychologist. And almost no community services, no inpatient, no outpatient, no consultation liaison, no research, nothing. That was in 2015. Perinatal psychiatry, non-existent, almost non-existent. I know our adult psychiatry colleagues do a good job in doing perinatal psychiatric services, but it's a specialized field. It's a much specialized field and very important field because you take good care of mothers, you will have better generations. So it's important how we should develop this specialty. So Sidra Medicine, where I work, how should I tell you? So this is the hospital construction started in 2006. And we opened the outpatient clinic in 2016, and the main hospital was opened in 2018. And it was vision of Her Highness Sheikha Moza bint Nasser, who was the queen at that time, now is the mother of the current Amir. This is how it looks like. So give you one idea, it has 7 floors. If I walked on one floor, it's about 7 kilometers. So total budget spent on this hospital in the last 6 years, about 7 billion US dollars. So a lot of funding went into health sector and education sector. It's an amazing, beautiful facility. I was trained at Children's Hospital, Boston, which is the best hospital in the world, and you can put 10 of those hospitals in this building. So it is that big. Beautiful facility. We have some amazing people who do excellent work, but I think our processes are not like what is in UK or US. It will take at least 10, 15 years where we want to go. When in 2016, I was the only child psychiatrist at Sidra, and I have an assistant and one business person. So we were 3 people, and we started this process. So I opened the clinic on June 1st, 2016. And it was an amazing moment. There was nobody. I have to do night calls, take all the administrative responsibilities, no staff, nothing. Only 3 people, and no psychologists. So that's where we started. This is now the child and adolescent psychiatry team. We have 7 child and adolescent psychiatrists. And actually, if you think about, I think this is more than what Pakistan has right now, Western trained. So all are Western trained. And I know Professor Iqbal Afridi is trying hard to start the child FCPS in Pakistan. Sir, 7 child psychiatrists for 600,000 people. We have 100 million children in Pakistan. And how many Western trained child psychiatrists? Might be 4, 5, and hopefully with FCPS, if we start, inshallah, at least we will have 4 or 6 every year. So need is huge. And some people think children are like young adults. No, children are not like young adults. Children and adolescents are very different and treated very differently. Actually, I know how the West and Pakistan, we do general psychiatry residency in West, and then you do the child psychiatry residency. Sorry? Because for me, my team is more important than me. So I am usually behind. I have taken enough limelight in my life. I don't need it anymore. So my team is more important. I will come at the end. Secondly is that I'm the chair of the whole department. So this is my child team. So I have 2 teams. One is child team and one is perinatal psychiatry team. So we have number of people in child psychiatry team. This was our CL team who provide all the consultation liaisons. So we do a lot of outpatient services. These are the most common diagnoses we see in our hospital: ADHD, autism, anxiety, and depression. Those are the 4 most common diagnoses we see. This was another milestone, March 2017. I think it was 16 March when we opened the first perinatal psychiatric clinic, I believe, in the whole Middle East. There are 22 countries in the Middle East. So it was a huge moment. Dr. Felice Watt she was in Pakistan a couple of times and was our division chief for women's services. This is how our perinatal psychiatry clinic looked like. It is situated in the obstetric floor. So it is not in psychiatric unit, it is in the obstetric floor. We have, I remember, somebody said, is one room is going to be enough? Now we have about 13 offices for consultations for women. It's very private, very soothing. We have places for breastfeeding, for babies, for prayers. So it is very soothing for the women who come to this. This is our perinatal psychiatry team, amazing team, which include 3 perinatal psychiatrists and 4 perinatal psychologists, and then a lot of support staff. And we do look at perinatal psychiatry. It starts from actually even when you think about preconception, and then it takes you to the different stages, pregnancy, birthing, early postnatal, and 1 year at least of infancy. And these are some of the most common diagnoses we see: depression, anxiety, OCD, some attachment issues, trauma. This is our CL services. So we have all the subspecialties, and our CL consultation liaison service is very busy on the medical floors, provide outstanding work. Then the perinatal CL team. So we have, like, for example, when we conceptualize, that's even in adult too, like in child psychiatry, you think about 4 major areas. One is your outpatient, second is your inpatient, third is your CL, and fourth is your emergency department. So any hospital, those 4 are the most common. Same goes for perinatal, same goes for other services too. But these are the 4 basics every hospital should have. How many of you know how many child and adolescent inpatient beds we have in Pakistan? Any guesses? It's very unfortunate. It's very sad. We have only 6 beds at King Edward, and Peshawar just opened a, I think, 10-bed unit. That is the situation in Pakistan, that how we treat our children and adolescents in this country, it's not right, how things are going over here. So when I started the clinic, in the first year, I saw only 60 families. So last year, we have about 13,000 patient visits. So where we were, just 60 to about 13,000 between my perinatal division and women's division. We are very lucky. There are 8 World Psychiatric Association collaborating centers in the world. And we are the 8th one. All the other 7 are for general adult psychiatry. We are the only one for children and women. Only one in the world. So in 6 years, I think that's a huge feat, and I'm very thankful to Professor Afzal Javed and his support for having this designation and involvement at the WPA level. Child FCPS I was talking about. In US, we use the system called ACGME for training. So there is Child Psychiatry ACGME Fellowship, which is a 2-year fellowship. So we opened the hospital in 2016, and we have fellowship, ACGMEI, US level fellowship, 2 years back. Within 3.5 years, we were able to put a child fellowship. Now we have actually 2 child fellows, and we are the only one in the world which has this ACGMEI fellowship outside US. So if there's a will, there's country's leadership behind it. If you want to do it, anything is possible. People thought this is not possible. There were so many hurdles, we're still able to pull it off. So we have, it's a training site. Weill Cornell Medical School is in New York. We have one branch in Qatar. So we have medical students from them. Qatar University, neurology fellows, developmental fellows, ambassador program. One thing which we did innovatively, which is very consistent with the public mental health model, that we go to schools, our team, and we educate the high school students, then who do the advertisement on the social media and raise awareness among the students in high schools, which is the way to go if you want to involve the students in high schools. Research, in a very short time, we have a research grants of about 6 million US dollars, and you can see number of publications. We publish about 20 papers a year, and about 50 to 60 international and national presentations a year. So my team has done, I think, some good work in this regard. Some of the future directions, I think we are working on developing more national models for CAMS and perinatal psychiatric services. We have only 2 CAMS bed, which is on the pediatric floor. We need a CAMS inpatient unit. That's one of the biggest thing which is left. Then mother-baby unit. In Asia, there's only 1 mother-baby unit in Bangalore for perinatal psychiatry. There's no mother-baby unit in the whole continent. It's a concept more focused towards UK, France, and Australia. Developing more community services, and the next goal is we have already developed a perinatal psychiatry fellowship for 1 year, and goal is to start it soon. These are some of the national things we are doing. National mental health strategy, national mental health law, some of the other strategies we are developing at a national level. Autism, very dear to my heart. There are only, I think, 4 or 5 countries which have a national autism plan. And Qatar is one of the countries which released a national autism plan in 2017. Why it's important? Do people know about World Autism Day? Have you all heard? So in 2007, Her Highness Sheikh Moza bint Nasser from Qatar proposed it to United Nations, which led to World Autism Day, which is celebrated worldwide. Sir, now I'm with my whole team, so you can see me now. So this is my whole team, both divisions, and some really good people. You know, when I was going, I was in Connecticut and doing very well in US. And a lot of people thought I'm crazy, why I'm leaving Yale, why I'm doing so well in US and I'm going to Qatar. And this was the quote in my mind, I have a dream. A lot of people have a dream in Qatar. I think we have at least achieved 90% of it. Thank you so much.